Hello everyone, welcome to the world of NCLEX Rn learning. In this video today we will discuss some of the important changes in NCLEX Rn exam by NCSBN. I hope all of you know that NCSBN is the one formulating and updating the NCLEX Rn test plan for the candidates. So recently they have made some changes in the NCLEX Rn exam, especially in terms of the total duration of exam and the total number of questions. So these main changes are connected with the pre-test items also. Before 2020 March, the total number of questions for NCLEX Rn exam was 265 questions and the total duration of hours was 6 hours. In that time, the minimum number of questions a student usually used to get was 75 questions. So out of that 75 questions, 15 questions was pre-test items, which means those question scores will not be used for our result. But from 2020 March until September, they have made some more changes in that exam plan. The main change is that the total number of questions will be 130 questions and the total duration of exam is 4 hours. And the minimum number of questions is 60 questions. So in this one, they exclude the pre-test items. The 15 questions of pre-test items they excluded. They have made this change basically because of the COVID-19. They want to include more candidates to accommodate the exams, and because of some of the main centers was closed and students they didn't get an allotment or the lot for to appear the exam. So for those reasons they have changed this aspects. So the last week I think some of you received a notification that again they are making some more changes in the exam plan. From 2020 October 1st onwards, the total minimum number of questions for NCLEX Rn will be 75 questions including 15 pretest items. And the maximum number of questions will be 145 and the total duration of exam will be 5 hours. See what are the main changes. The duration of exam was, first it was the original exam 6 hours, then they decreased to 4 hours, now they are going to change for 5 hours from October 1st on 2020. And the total number of questions, before it was 265, now 130, and from October it will be 145. And the pre-test items was there in the original exam before 2020 March, and during this COVID period until this September they removed that pre-test item, and now October onwards again they are going to include that pre-test items also. So these are the main changes, important changes which is very essential for the candidate should know before you are going to appear the exam. I know most of you might be preparing and some of you got your ATT and you are going to appear the exam on the coming months. So you should be very aware about these factors. Then the another main thing I want to inform to everybody is that there will not be any change in the difficulty or the passing standards of the exam. The exam will be same like the original exam like before, and the question patterns and the type of questions and the passing standards, everything will be same. There will not be any change in that. Just keep in mind that one, because some of the students they have asked when they will decrease the questions, they might be the exam will be easy or the type of questions might be different. There is no different in those cases. There will not be any change in those aspects. Those will be the same like the original exam, same like the exam which was happening before March 2020. I hope this is clear to everybody. So if you are preparing for your exam, study well, concentrate on your topics, each topic and category areas, and always study with the updated syllabus and updated question banks. And I wish you all the very best to all of you and keep learning. Bye bye.